Welcome to the Spine Surgery Preoperative Education video for Cervical Laminectomy. My name is Megan Curtis, and I am a nurse practitioner in the Department of Neurosurgery. I'd like to personally thank you for choosing Michigan Medicine for your upcoming spine surgery. The goals of this video are for you to learn how to best prepare for surgery, know what to expect after surgery while recovering, understand the do's and don'ts after surgery, because ideally our goal is that you achieve the best surgical recovery possible. For those of you undergoing a cervical laminectomy, the surgery is performed with you lying on your stomach. A vertical incision is made to the back of your neck, and a portion or the entire lamina is removed. You may also have disc material or bony buildup removed if it's causing pressure on the nerves. This slide is your preoperative checklist. The first item on this list is to read. You will be given informational material at your history and physical visit. One of the most important things being an individualized medication list with instructions for if and when medications need to be held before surgery. It's important to look at this list right away, as some medications must be held up to a week before surgery. The next item is plan. While you're not going to need constant care after you're discharged from surgery, ideally someone will be able to check on you daily if you need any assistance in the first few days following your surgery. Additionally, you need to designate someone ahead of time who will be able to take you home after you're discharged, as you won't be driving yourself home. The next item is what to bring. We recommend you wear into the hospital what you wear home. This should be comfortable and loose-fitting, especially around your neck. You may choose to bring eyeglasses, but notice I didn't say contacts. For those of you that wear contacts, you'll need to bring glasses, as contact lenses are too difficult to deal with in the hospital right after surgery. You can bring a robe if you're going to be admitted, but not pajamas. You'll be in a hospital gown during the hospital stay to allow us to examine you and for your IV line. You're certainly allowed to bring a few personal toiletries. However, the hospital does provide some basic supplies. Bring your ID or driver's license as well as your insurance card. And most people like to have their cell phones with them to contact friends and family, but also don't forget to bring your charger. And if you are being admitted, which we will tell you ahead of time, and you have sleep apnea and use a CPAP machine at home, we recommend bringing your own machine labeled with your name on it. Lastly, don't bring any valuables with you to the hospital. The next item is wash. We want you to wash your entire body with antibacterial soap as close to surgery as possible. If you find out that your surgery is early in the morning, then you'll do a shower the night before with antibacterial soap. If it's in the afternoon, then ideally you'll shower in the morning of surgery. And then lastly, arrive. We recommend allowing 15 to 20 extra minutes than anticipated to get to the hospital, especially if you're not familiar with the Ann Arbor area. This will prevent you from being late and give you any extra stress, especially if you run into traffic or construction or happen to get lost. This next slide talks about how to prepare for surgery. First, we recommend that you find a support person, or a care coach as we call it. Maybe that's your spouse or your child or another family member or even a friend. It's important that someone in your life knows what you're about to go through and what your restrictions and limitations will be after surgery. After undergoing surgery, the more help you have and support, the better. Next, it's important that you stop smoking. We know that smoking is bad for your health, but it also contributes to degenerative disc disease in your spine and can delay healing. Everyone must stop smoking before surgery. Next is reducing constipation. While you won't have a formal bowel prep before your surgery, you will be more comfortable after surgery if you've had a full bowel movement before coming into the hospital. The surgery itself, along with general anesthesia and the pain medications we give you, are known for increasing constipation. Ideally, if you're constipated, you should have a bowel movement about 2 days before surgery, but do not take any laxative the night before or the day of surgery. The next item is surgical clearance, if needed. Our department is responsible for contacting your doctors and getting the clearance. I just put it on this slide because often a provider wants to see the patient in their office before providing the clearance, so I just want to bring it to your attention in case you get a call trying to arrange an appointment. If you have any medical leave or short-term disability paperwork, it must be sent to our office in the Taubman Center on the second floor, likely where you met your surgeon or nurse practitioner. While our inpatient staff is absolutely a part of our neurosurgery team, they don't complete paperwork. We actually have someone in our clinic designated to communicate with your surgeon and fill out your paperwork accordingly. We also scan that completed paperwork into your chart and can fax it wherever it needs to go for you. This keeps it all centrally located and easily accessible. You can drop off the paperwork to the office or have someone do it on your behalf. You can fax it as well as mail it. Lastly, for those of you that do live far away, Michigan Medicine has a small hotel in-house called the Med Inn, as well as nearby hotels that we've partnered with that offer discounted rates. It might be easier to stay the night before down here if you live several hours away. The phone number is on your screen to call for reservations, 1-800-544-8684. If you are interested, I recommend calling as soon as possible as these rooms do book up. Additionally, if you live far and a friend or a family member is going to be staying down here until you're discharged to be able to take you home, they qualify for that discounted room rate as well. Now let's briefly talk about medications you need to stop taking prior to surgery. Remember, each patient is going to get a detailed list of their medications with directions as to when they need to stop, if applicable, at your history and physical visit. But in general, 1 week prior to surgery, stop taking any herbal supplements, vitamins, and over-the-counter weight loss products. You also need to stop taking NSAIDs and similar medication like ibuprofen, Advil, Motrin, Aleve, Mobix, Celebrex. You need to stop taking all recreational drugs, especially marijuana. The active ingredient in marijuana, called THC, interferes with our ability to put you under general anesthesia and also makes controlling your pain difficult after surgery. If you're on prescription blood thinners such as Coumadin or Pradaxa, Eliquis, Brilinta, do not stop these on your own. They do have to stop before surgery, but we are responsible for requesting a clearance for you to come off those from your prescriber. Continue taking all your other medication as prescribed unless directed. Now let's talk about what to expect after surgery. I would like to start by saying that every patient and every surgery is different. Sometimes after a cervical laminectomy, a patient is discharged home the same day after they recover, but other times they are admitted for a night or two in the hospital. You will know whether or not your surgeon plans on admitting you prior to surgery. If you do not yet know at the time of watching this video, feel free to reach out to your care team and ask. Now, if you are admitted to the hospital after surgery, I'd like to start by saying that our neurosurgery team rounds very early. You can expect a visit from us between 6 and 7 a.m. daily. We like to see you early to be able to speak with you, examine you, evaluate your progress in order to make a plan for the day. We might need to consult physical therapy or another specialty, or it just helps to determine your discharge plan. Seeing you early prevents any delays in your care. Also, most of you will have a urinary catheter inserted when you're under anesthesia. This is typically removed before you wake up or shortly thereafter, but I do mention it because sometimes after being catheterized, the patient's bladder gets somewhat stunned and your sensation to urinate is decreased. Our staff will be monitoring you closely to make sure that you have a return of that full sensation to void. Next is the use of an incentive spirometer. That is the little machine made of plastic to the right of the screen there. After surgery and lying flat for a few hours, fluid can pool in your lungs and become a source of infection, which we don't want. It's important that you keep your lungs clear with the use of this incentive spirometer. You'll be directed on how to use it specifically when you arrive on the floor. Basically, it helps you take deep breaths to keep your lungs open and healthy. Next is the use of heparin and SCDs. After surgery, you're at risk of blood clots forming. Heparin are small shots typically given in the stomach 2 to 3 times a day. And while we know this is somewhat uncomfortable and it can cause bruising, it's also very effective in preventing a dangerous blood clot. We also use SCDs, or sequential compression devices. These are soft, painless Velcro wraps that go around your lower legs, and they inflate and deflate to circulate your blood. Lastly, we'll encourage you to get up and move. This might be sitting up at the side of the bed initially or sitting in a chair, but ultimately we want you up and walking. This also helps to prevent respiratory infection and any blood clots. Let's talk about some common symptoms that you might expect after your surgery. Nausea is the most common symptom that people experience. It's usually caused by the general anesthesia or the pain medications that we give you. If you become nauseated or you know you're prone to nausea, don't hesitate to tell us. We have medications to help with this. We don't want you not taking pain medication because you're afraid you'll get nauseous and vomit. We can give you the anti-nausea medication that's called an antiemetic. We'll give that first, and then once it kicks in, we can give you the pain medication. Another tip is to eat and drink slowly after surgery to decrease the chance of nausea. Another common symptom is constipation. It's common to be put on stool softeners after surgery to help you have a bowel movement. If you're known to be prone to constipation, please let us know. We can order whatever you need to help you go. And lastly is pain. Given the nature of the surgery, you are going to have pain afterwards. Our staff is going to be monitoring your pain frequently while you're in the hospital and asking you to rate your pain from 0 being no pain to 10 being the worst pain of your life. For the first day or so, if you're admitted, we would give you IV pain medication. But then we need to switch you quickly to oral pain medications because that's what you're going to be going home on, and we need to make sure that it's effective. If you're discharged the same day, you'll also be leaving with a prescription for oral pain medication. In addition to medications, you are free to reposition yourself, get up into a chair for comfort, or use an ice pack around your neck or shoulders for pain relief. Okay, now let's talk about discharge. Remember, some patients are going to be going home the same day as their surgery. Others will stay with us overnight. Before going home, we need to make sure that you're able to eat without any significant nausea or vomiting. We need to make sure that you're able to get up and walk around safely, or at least that your mobility is back at your baseline, meaning that if you were using a cane or a walker before surgery, you're going to be using one afterwards as well for safety. We'll also check to make sure that you can urinate without difficulty and that your pain is controlled with oral medications. Lastly, depending on your surgery and your surgeon, there is a possibility that your surgeon will want you to wear a neck brace. This will be discussed on an individual basis. All right, this next slide is very important. It's all of your post-operative do's and don'ts after undergoing a cervical laminectomy. Now you'll notice on the left here, the first do is to get up and walk around. Remember, you are at increased risk of a blood clot forming after surgery, so we want you up and moving. There is no bed rest at home after this surgery, and there are no walking restrictions. However, if you happen to be having a bad day and the pain happens to be high, the minimum recommendation is that you get up and walk around every 2 hours while you're awake for a few minutes. This does not mean that you get up during the night to walk. We want you to get that healing restorative sleep, so it's only applicable to during the day. The next do is washing your incision. Your incision can get wet with soap and shampoo in the shower, but if you don't shower daily, that's okay. You still need to wash the incision with soap and water at the sink and pat it dry. Now let's move on to the don'ts. The first is no lifting, pushing, or pulling over 10 pounds. That means no lifting laundry baskets, grocery bags, yard work, etc. And then no repetitive bending or twisting. Notice it says repetitive, so normal neck movement is fine. Don't try to keep your neck stiff on purpose. This is only going to increase your pain. But repetitive movements are like bending over to pick weeds repeatedly, twisting to put dishes away from the dishwasher into the cupboard, mopping, sweeping. The next is no driving for at least 2 weeks. However, you can be a passenger at any time. You are not required to stay in your home, and you can certainly get out of the house if you feel up to it. If you are instructed to wear a cervical collar, your driving restrictions will last longer. In terms of care for the incision, you cannot put any type of lotions or creams on it. This includes Neosporin, bacitracin, or Mederma scar creams. Nothing needs to go on it. While your incision can absolutely get wet in the shower or washing it daily, it could not be submerged in water, such as a bathtub or a hot tub, a pool, or a lake. While I don't expect there to be any complications after surgery, it's still very important that we talk about red flag symptoms that you need to be aware of. I need you to contact us immediately if your incision changes and becomes more red, swollen, painful, or hot compared to how it was at discharge. So that means we expect some redness and tenderness and maybe even swelling, but this should only decrease slowly with time. This should not increase. The next symptom to be aware of is any drainage from your incision. You would need to notify us. Similarly, if the incision opens up, we need to be contacted right away. The next symptom is if you develop a fever over 101 degrees. You may run a low-grade fever after surgery, but over 101 is not expected, and we would need to be notified. If you develop any new symptoms that you did not have when you were discharged, including increased pain that is out of control and not helped with medication, any weakness or numbness to your arms, or if you develop any bathroom difficulties, meaning you suddenly lose control of your ability to hold urine or stool, or you have no sensation to go to the bathroom, we need to know about it. Now, if any of these symptoms occur, we need you to call the office. Some of you are very comfortable communicating with us via the portal, and that's great. But do not put a portal message into us with a red flag symptom. It might not get looked at until the end of the day, and we would never want your symptoms waiting all day. We want them addressed immediately. We understand there could be a wait on the phone before someone answers, but please be patient because your call is very important to us. If you feel you need immediate attention and cannot get a hold of us via the phone, please report to our ER, or if you live very far away, then your local ER for evaluation. Okay, let's talk about pain management after discharge. I'm reminding you that you are having spine surgery, so pain is going to be expected. Our goal is most definitely to keep you comfortable, but not necessarily pain-free immediately after surgery. When you're discharged, you will go home with a 7-day supply of pain medication. You are entitled to a refill if needed. In order to get a refill, you must call our clinic during business hours, so 8 a.m. to 4 p.m. Monday through Friday. We do not refill after hours or on the weekends. This means you need to be aware of how much medication you have left and call us at least a full day ahead of time to request a refill. We also run a MAPS report on every refill request. That is an acronym for a Michigan Automated Prescription Service that tells us where you have obtained opioid pain medication, when and from which provider and what pharmacy. If you obtain opioids from another provider during the time that we're prescribing for you, we are no longer able to prescribe medications. This includes going to an ER for pain. We should be the people that you call first. If you normally see a pain management physician, it's your responsibility to contact them before surgery to make a plan for medication, especially if you've signed a medication contract with them. Some doctors will allow you to take the first refill from us and then want you to go back to them for further prescribing. We would only prescribe for you for an absolute maximum of 1 month after surgery. So it's really important to get this arranged ahead of time if you have another prescriber. Now let's talk about follow-up plans. We're going to follow you for a few months to evaluate your progress physically and see how you're doing after surgery. Your first visit, if your incision is closed with staples, will be at a 2-week mark for our spine nurse to remove those staples. Other patients will have their incision sewn from the inside out and then glued on top. Every patient is going to have a 1-month post-operative visit and a 3-month post-operative visit. This might be done in person or via video. Additional visits can be scheduled as needed. Okay, well, that concludes this video. If you have any remaining questions, please don't hesitate to ask us. That's what we're here for. You can reach out to your provider or your nurse practitioner at your next visit. You can feel free to call our office. The phone number is on the screen, or use your patient portal through the MyChart to send us a message. I want to thank you again for watching this video, and thank you for choosing Michigan Medicine.